Thank you, Chair. The meeting is now live.
Thank you for that, and good afternoon, everybody, and welcome to this meeting of Bracknell Forest Council's Local Outbreak Engagement Board. I think, first of all, we will do the roll call for those that are here.
Thank you, Chair. I've received apologies from Councillor Bettison, Abby Thomas and Shamarke S. As is sometimes the case, people can have problems accessing a digital meeting, so anybody who does not appear in the call and is a board member will have their apologies recorded. Members of the board, please turn on your microphone and confirm you're present when I call your name. Anyone who does not respond will be recorded as giving their apologies. Councillor Dr. Barnard.
Present.
Councillor Bettison, I've received apologies for. Councillor Birch.
Present.
Councillor Brunel Walker.
Present.
Andrew Hunter.
Present.
I've received apologies for Abby Thomas. Kelly Williams.
Present.
Elena Rozelle.
Present.
Gabby Hafner.
Present.
Acting Inspector Sophie Gardner. I'll record apologies for Acting Inspector Sophie Gardner. Fiona Slevin Brown. I'll record apologies for Fiona Slevin Brown. Philip Bell.
Present.
Thank you. Is there anybody else on this call whose name I've not called?
It's Councillor Mrs. Hayes observing.
Thank you, Councillor Hayes. Thank you, Chair. That concludes the roll call.
Brilliant. Thank you for that. Agenda item 2 is declarations of interest. Does any member have any interest to declare any items on the agenda? Please signify now in the chat if you do. I see no notifications. Any urgent items of business under item 3?
Yes, Chair, we have an urgent item of business from Kelly Williams to discuss the new measures that were introduced today.
Can I just seek guidance as to whether we want to take those now or whether we slot those in as part of the other agenda items?
I'm happy to provide that update after the data, if that would be helpful.
If just where it makes the most logical sense, Kelly. So if that's the right place, then let's do that. Okay. Any other urgent items of business?
No, Chair. There's no further items.
Wonderful. Thank you. Moving on to agenda item 4. In that case, the national and local COVID-19 status update. Great. Thank you. Yep, the screen's loading on my end.
Abby, are you on mute?
Sorry, I've struggling to get off mute. I'm so used to Teams, I do apologise. Hopefully you can see the screen now and hear me, which was all technology rolling, so that's good. So this is the usual update for the Local Outbreak Engagement Board on the current COVID-19 status. So the situational awareness for Berkshire and the surrounding areas. So this is the important column here, the cases per 100,000 population. And the average rate in the last 7 days for England is 440, but for the southeast it's 574. So Bracknell Forest is currently 505.8, so we're below the southeast average, but above the England average. And as you can see from these figures, that bar Slough, we are the lowest in Berkshire. And in fact, our numbers have actually come down a little bit from 529 yesterday. But since we last met, they have dropped all the way down to 350 on the 9th of November and back up to this level now. And that's similar to other local authorities in the southeast. The southeast as a region is the highest, has the highest case rates in the country at the moment. You can see that our numbers for the over 60 population are going down, but they are still ahead of both the southeast and the England average. And the level of positivity is largely in line with the picture that it was on the 2nd of November when we met last time. Looking at that picture for Berkshire, so just to remind you that the blue line is Berkshire, the grey line is England, and the orange line is the southeast. So you can see that Berkshire is tracking just under the southeast average line, but above the England line. And when we last met, it was here, so we were on the way down, and unfortunately, we're now currently on the way up. When we look at that picture for each of the Berkshire local authorities, you can see it's rather similar. And we're all on an upward trajectory, having suffered a dip which we probably was the result of half term, but now the children are back at school, we're really seeing those numbers pick up. Looking at part of the southeast region, now just to point out that the colour coding has changed since we last met. The dark blue used to be 250 plus and it's now 500 plus, which reflects the times we're in, sadly. So here we are, this number 1 here, and we're in a lighter colour than our neighbours. The Royal Borough here are in the dark blue, as are West Berkshire. And you can see that both of those local authorities are close to areas with other darker higher numbers, and it may be possible that that's the reason for their high rates. I've put the previous week here. Normally I would put the previous month, but because the colours don't work, you can see that we've all got an increase in case rates this week compared with last week. Looking at how those cases are split into age groups, you can see that for Bracknell Forest currently, about 42% is represented by the under 18s. When we met a month ago, that was 50% or higher. So you can see that the rate of school-age children is still high, but more in proportion to the rest of the other age groups. And last week, the numbers were quite similar to the picture now. Looking at the wards in Bracknell Forest Council, again, the colour coding has changed, like the other graph picture, to show that 500 plus is now in the dark blue. You can see that last week that was just this area at the top here, Binfield with Warfield, and now we have more areas in that dark blue area. But interestingly, we also have a couple of wards such as College Town down here and Great Holland South, which actually had decrease in rates since last week. Looking at the wards by the numbers of cases and the case rate in the last 7 days, for which we've got a full picture, you can see that the highest numbers are Binfield with Warfield and Harvest Ride. But in terms of the rate per 100,000, Old Bracknell is one of the highest this week. And that's reflected in the pictures we saw on the previous slide. My favourite, the heat map. As you can see, it's rather solidly dark. The darker the colour, the higher the case rates down in this school-age children patch down here, but also in this range here, which is probably the parents of those school-age children. Up at the top, our older population, the case rates are much lower, and we have a smaller populations in those age bands as well. So looking at the numbers, currently it's the 5 to 9-year-olds primary school population that has the highest rates at 1,400. Last week that was only 1,000. I say only, that's still a very high rate. Previously, when we met, the 10 to 14-year-olds age group was close to 2,000 per 100,000. So you can see that it's now the younger children that are experiencing the highest case rates in Bracknell Forest. Moving on to vaccinations in Berkshire, we're doing quite well, really. On the whole, we're above the South East and England averages, which are down in these bottom rows here. And just to pick out some numbers, this 40 plus here, 89% for Bracknell Forest, whereas the South East average is 88 and the England average is 86. So we're ahead of the game. And certainly those of us who attended the Health Protection Board meeting earlier today, with the Frimley ICS region is one of the best in the South East. And our rates for booster vaccinations, which are just coming through now, are very good, particularly in the 70 plus age group. And that's starting to go down the age groups as more people become eligible. Looking at the picture in the Frimley ICS hospitals, while the numbers of people in hospital looks fairly static on here, we are hearing from the NHS that they are under extreme pressure. They're experiencing a lot more people through A&E, and they do have quite a lot of people taking up ITU space in hospitals due to COVID. So they are feeling a lot of pressure, and we're not in the thick of winter just yet. With regards to deaths for Bracknell Forest, we've had 203 COVID-related deaths throughout the pandemic, and that represents an all-cause mortality of 9% higher than the previous 5-year average. So that's 157 additional deaths. And just moving on to the latest issues, I'm sure you won't have escaped the news about the Omicron variant. So that was discovered by scientists in South Africa, and they were very good in sharing information widely and quickly last week to let other parts of the world know about this new variant of concern that's been named Omicron. The scientists are learning more every hour, and what we do know is that it spreads very rapidly and can be spread between people who have been double vaccinated. There is quite an extensive mutation to this variant, and they're still working out what the impact on the current types of vaccine that are available in the UK are, and we hope this information will be available soon. As at lunchtime today, there were 14 cases in the UK, most of them in Scotland, but some in London. So far as we're aware, there are none in Berkshire at the moment. And the government has stepped up some additional measures that Kelly will cover in her briefing to try and buy time for the scientists to understand this variant of concern and help the NHS prepare for a very challenging winter. And that's the end of my presentation, Chair.
Wow. That's sobering. What really I think is staggering is if you go back a few weeks in time to the chart of the. I think what's always been very powerful is the coloured bar chart and the spread through the age groups. And I distinctly remember sitting here a few weeks ago looking at it where it was our older population was less impacted, and then we saw that, and it was down in the bottom right hand. To see that whole chart is sobering, and if anyone is under any doubt as to the seriousness of this, that should just answer your questions. Sorry, yeah, it knocked me slightly for six. Kelly, do you have anything you want to add to that, or do we have any questions? And I noticed, just for the record, that Councillor Paul Bettison has joined as well.
So nothing to add in terms of the data. I'm happy to move on to the additional measures that have been introduced if no one has any questions for Gabby.
Brilliant. Any further questions for Gabby? I'm not seeing any. Kelly, over to you.
Okay, just sharing my screen. Okay, can I just check that you can see that?
Yes, thank you.
Yeah, okay, perfect. Okay, so Gabby's just given us a bit of an introduction there in terms of the new variant that that has emerged in the last week or so, or that we've become aware of in the last week or so. So as you will no doubt have seen in the news over the weekend, there are a number of measures that have been introduced by the government in order to try and buy us time to firstly understand more about the potential implications of this variant of concern, and also continue to build the protection that we have available to us. So I'm just going to summarise some of the changes that have been implemented. Broadly speaking, they fall into two different categories. The first of which is a focus on preventing seeding within the country. So that's around strengthening the protection that we have in terms of new cases being brought into the country and then spreading within local communities. So two really key changes in terms of changes to travel. So the first being that for everybody returning to the UK, regardless of the destination that they're travelling from, those individuals will once again be required to participate in a PCR test. A day 2 PCR test, so that means within 2 days of arriving back in the country, they have to take a PCR test. And the key change is that anybody who takes one of those PCR tests will now be required legally to self-isolate until they get the negative result. So previously, whilst day 2 tests were required, there wasn't necessarily a requirement to self-isolate. That now is back in place. And those rules come into effect from today, the 30th of November. There are two separate regulations requirements now with regards to travellers returning from red list countries. So firstly, for anyone returning from one of 6 red listed countries that were announced over the weekend, so the first 6 countries that were identified, all Southern African nations, up until arrivals up until 4 o'clock on the 28th of November will be required to complete a 10-day quarantine period, but that 10-day quarantine period should take place in the individual's own home. So they're not required to go into a managed quarantine service hotel if arrival was before 4 a.m. on the 20th of November, but they are required to self-isolate or quarantine at home for 10 days following the date of their arrival. The other thing to confirm with regards to travellers who return before 4 a.m. on the 28th of November, there is also a requirement for anybody else in your household, regardless of whether or not they returned from a red list country themselves, to self-isolate for 10 days. So if a member of your household has returned from one of those countries, you yourself must also isolate for 10 days. For those people returning to the UK after 4 a.m. on the 28th of November, those individuals are required to go straight into one of the managed quarantine hotel services that have been stood back up and isolate there for a 10-day period. And you'll notice that that now applies to 10 countries, so 4 more than were initially identified early at the weekend by the government. So that really focus there is on preventing seeding. If we move on to the next 3 slides, which focus on the changes that have been introduced, which aim to limit or reduce the transmission of cases once they are in the country. So the first of those is a change to the contact tracing process. Effective immediately, any close contacts of confirmed cases of Omicron will be contacted by NHS Test and Trace or the UK Health Security Agency and advised to self-isolate for a period of 10 days. That's regardless of their age and their vaccination status. So current self-isolation exemptions are in place for those who are under the age of 18 or who are fully vaccinated. Those exemptions do not apply if you're a close contact of a confirmed case of Omicron. Also, in terms of the contact tracing arrangements within schools, there is no change to the process for identifying close contacts in schools, although this will be overseen by either National Test and Trace or the local health protection team. And as I say, there is no exemption with regards to age. So children who are identified as close contacts of Omicron cases will also be required to self-isolate for 10 days. So the next action in terms of limiting the transmission of the variant relates to face coverings. So there is, effective from 4 o'clock this morning, return of a mandatory requirement to wear face coverings in shops and other settings such as banks, post offices and hairdressers, as well as on public transport. So that's a mandatory requirement for everyone to wear face coverings unless you have a medical exemption. In terms of our local businesses, so our local shops and other services, our public protection partnership are already working to proactively reach out to those businesses and provide them with support around the new regulations and the measures they need to put in place. So just to confirm, the mandatory requirement does not cover either hospitality settings or workplaces. But as a local authority, we continue to strongly advise people to wear face coverings if they are anywhere indoors or crowded or mixing with people that they don't normally mix with, to provide that extra barrier of protection. In addition to shops and public transport, there has been a return to mandatory face coverings for students of secondary school and college age, and for staff and visitors in communal areas in all education settings, so early years, primary, secondary and further education settings. So communal areas only, but mandatory requirement for face coverings has returned in those settings. So the third element in terms of reducing the risk of transmission is some changes to the vaccination programme. So government have confirmed that there are a number of changes that they've asked the NHS to work on. So firstly, providing a booster dose to everyone over the age of 18. So presently, it's only those who are age 40 and above who are eligible for a booster dose. That's going to be expanded to everybody over the age of 18. Secondly, also providing a booster dose to people aged 16 years and over who have a severely weakened immune system. A change in terms of the timeline between the second dose and the booster dose. So currently it's a 6-month gap between having your second vaccination and your booster vaccination. That will be reduced down to 3 months rather than 6 months. And then secondly, confirmation that a second dose will be offered to all children aged 12 to 15 years who are not already eligible due to compromised immune system, but again, with a gap of 3 months. Information that we have from colleagues in the NHS at the moment is that whilst the government have confirmed that they've asked the NHS to work on providing this additional elements to the booster vaccination programme, they're not currently in place. So at the moment, you can't book if you're in one of the cohorts outlined on this slide here, but please do check the NHS website for the most up-to-date information. It currently does have a message on there advising that the NHS is working on putting those plans in place and you can't yet book, and that will be updated once that position changes. So that's the best source of information in terms of monitoring that. And then the final area that that has been publicised quite widely over recent days is that 4 areas where cases of Omicron have been confirmed. Local authorities, along with health protection colleagues in those local authority areas, have once again stepped up targeted testing. So similar to surge testing, in some areas that's focused on particular settings where the positive individual may have visited. So you will no doubt have seen in the news the example in Essex of the Kentucky Fried Chicken shop and the church that was visited by a member of the public who's tested positive. So there may be a requirement for us to step back up surge testing or targeted testing, which could be either based in specific geographical areas or particular settings, depending on the risk assessment if cases are identified. So we're also taking steps at this point to prepare for that should it be necessary. So that's all I have. I'm happy to take any questions.
Thanks, Kelly. I'll go around the table in a second. I had a couple of quick ones for myself. Dr. Barnard, I can see your hand is up as well. I guess this is more of a question for Elena when she comes on to the comms update. But just when you reflect back on that one slide with the ones in it, how the hell do you simplify the message down? I mean, we have quite a large South African population in or community within Bracknell Forest. You know, how do we simplify the message down? We've always used a hands, face, space. We've said protect our borough. We've taken all of those strong, powerful, simple one-word messages. But how do we simplify the kind of the differences in the reds? How do we make this point across? That's one. The second, and Elena, feel free to say, I'll deal with that in my section. The second point is I'm getting a lot of people, I mean, a lot of my residents who are trying to book slots. I've had probably in the last couple of days, 15, 20, maybe 25 approaches from residents on our email and social media about their confusion over booking tests, for some first, for some second, for some third. You know, least of all is the fact that in the background, since I started this call, I opened a session on the NHS website and I'm still 3,412 in the queue. But there's lots of confusion about what it means. And can people in Bracknell Forest just walk into Waitrose? I'm concerned that whilst we've got an excellent take-up of vaccinations at 1 and 2, trying to deliver the boosters, if we're now going to have the ability to roll out 12 to 15 and the younger groups, do we have the capacity and the simplicity of the message to be able to say, do this, do this, do this? Because the Gov website is not particularly straightforward to go through 20 different questions on screens to then find out that your nearest place is in Farnborough or Fleet. I think I was off at Aylesbury yesterday. How do we get the message across about what that actually means, or keep trying, or keep doing? And then how do we make sure that we have sufficient capacity across the local network here to be able to deliver first, second, and third boosters, or fourth, if that's the case, or whatever that's going to look like? Does those questions make sense?
Yeah, they make complete sense. I'll respond initially, and then Elena, feel free to chip in, or Gabby as well. So firstly, the point about the difference between the returning for red list countries is only going to be an issue for a very, very short period of time. So that only applies. The first section of home quarantine only applies to people who are already back in the country and have been for at least a couple of days now. They will be contacted directly themselves and advised of the requirement to self-isolate for 10 days. So anybody else will be directed immediately to the managed quarantine hotel service and won't be able to return to the country until they can confirm booking of that service. So that was really just in terms of awareness. I've seen some comments on social media with concern amongst members of the community that they're aware of neighbours, for example, having returned from perhaps a red list country and they're not in a managed quarantine hotel. So it's just really to outline that you can't, at the point that the managed quarantine hotel service went live, you can't return to the country without being directed immediately into that. So hopefully that addresses the point about the kind of the two different requirements.
Yeah. And is that part of the plan to reopen Terminal 4 as a red country terminal?
I'm not aware of that at the moment, Chair. I'm aware that the current managed quarantine service hotels that have been stood up are in the around the Heathrow area, but I'm not sure of the particular sort of logistics. With regards to the question about the booking of slots, I think perhaps the biggest issue or challenge at the moment is that the government have announced their intention for the booster vaccination programme to be significantly expanded. But at the moment, that's not a live process. So I can give you assurance, Chair, having just come from our East Berkshire Health Protection Board meeting, that our colleagues in Frimley CCG are working incredibly hard and at great pace to stand up the additional capacity that is required. And they will be in a position, once they're in a position to open up that booking, then that will be communicated. So really my advice to all of our residents is, if you are in the under 40 category, so you've not yet, or up until this point have not been able to book your vaccination, please don't try and book your vaccination yet. Those slots are not available for you, but they are coming. And my advice is to monitor the NHS website, which will let you know when that booking process goes live. And once it does go live, there will be sufficient capacity within our local system to be able to meet the local need.
Thanks, Kelly. And Gabby, please don't think for a moment that was a criticism of the outstanding work that your colleagues and your organisation have done. It wasn't intended to come across as a criticism. It was more of an observation. Elena.
Thank you, Chair. Yes, I completely agree with you that the messages are quite complicated and they're quite complex, and they are a change from what people are used to. We're in a position where people are used to the relaxation of lots of different restrictions. So we feel like as communicators that we've gone back perhaps to where we were last year. So it's really about boiling down those messages, making sure they're in as simplistic language as possible, and actually that they're as visual as possible. We do understand that there are members of the public out there who don't want to read reams and reams of information. Actually, being pictorial in our messages is quite key. So the strap line that we've actually gone with, which is in production, it's not ready to roll just at the moment, just because we don't get the information any quicker than the public do. We found out about these changes on Saturday evening, as everybody else did. So we've been working really quickly over the past couple of days to get the message of hands, face, test and isolate out to our public. So it's kind of evolving the hands, face, space message and making it quite clear where our responsibilities are as the public sector, but also as residents, where they need to take some action and really look after themselves. So we have lots of different outdoor advertising opportunities coming up over the next couple of weeks that we've just booked in today. We've also got messages in things like Town and Country, which is going out in the next couple of days. We're using our digital media channels, and we've got information on our website. So they are really key to making it really simple and making it as understandable as possible, because I do agree with you, Chair, it is quite confusing if you go onto the Gov website, because there needs to be all of that information. We just need to give our residents what they really need to make those behavioural changes.
I totally agree, especially when you now just see that the Prime Minister has just announced that by the end of 2022, by the end of January 2022, all adults will be able to be eligible for their booster, and 400 military personnel across the whole of the country, presumably, have now been drafted in to accelerate. I'm not sure what the 400 will do, but Gabby, I'm sure you'll be using every resource you get from government for that. Councillor Barnard, you had a question.
Yeah, thank you. Just first of all, an observation on booking your vaccination booster. the Waitrose Sports and Leisure Centre does not come up on the list very often anymore, which is totally frustrating, because if you think about three things, first of all, accessibility for Bracknell Forest residents, it is more straightforward than the default that appears to be Maidenhead. And secondly, there's a not insignificant cohort of people who probably would feel more reassured to go back to the place where they received their first jabs, particularly if they're uncomfortable with this, if it's back at Waitrose Sports and Leisure. And I do think this is a really serious issue, because if you go in person to book a slot, which of course increases the mixing, I've been reliably informed you can get slots which are within the timescale that you would expect. So clearly something is not working on the government algorithm. It's probably nothing to do with it's nothing to do with the local thing, but this is really significant and serious. So I don't know what influence you have, but it just does not come up as far as many people are concerned at the moment. And I do not want that to be an issue to put people off coming forward for their booster vaccination. So can I just leave that one there? The other thing, Kelly, is since we last met, we've had representations from organisations which benefit from school visits, suggesting that the guidance that we issue to schools rules out school visits. Now, I understand and recognise that schools will undertake their own risk analysis of a situation, but can you, for the purpose of this meeting, just clarify the position that we have as a council in our public health role with schools with regards to schools trips and visits, particularly in the run up to Christmas, notwithstanding the changes we've discussed today?
Yes, yeah, of course, Councillor. So firstly, with regards to your point about Waitrose and the national booking system, I'm just conscious that we, understandably, given the weekend's announcement, don't have any colleagues from the health service on the call
Understood.
with us today, but I'm more than happy to provide that feedback and ask that, that's looked into.
Absolutely fine, Kelly. That's very helpful. Thank you.
Yeah, thanks. With regards to the point about the schools, and we have provided some updated guidance to schools just this morning, actually, across Slough, the Royal Borough of Windsor Maidenhead and Bracknell Forest. So there are some things that are being recommended in a blanket way, and there are some things that are down to individual school risk assessment. So in terms of the blanket recommendations that have been made to schools in all three East Berkshire authorities, there are a number of recommendations which I believe I ran through at the last one of these meetings,
Yes,
which essentially focus on reducing mixing where possible on the school site, and that's kind of regular day-to-day mixing. So things like avoiding whole school assemblies where possible, also enhanced testing measures, so the use of daily LFD tests for close contacts and household contacts, including for primary school children. So those were the generic and blanket recommendations that were made by the Health Protection Board across all of schools in the three authorities. As part of that, there were no recommendations to cancel or suspend any type of one-off event or activity. Now, that could range from a nativity play taking place at the school, to a residential visit away, to a day trip somewhere, to parent and teacher evenings, or sort of taster sessions, or open events for new parents. So all of those one-off events are not, we've not made any recommendations about those in a blanket way. So all of those activities can go ahead. The caveat to that is that we have a large number of schools in the borough now who have very high levels of COVID cases. You saw in the slide that Gabby shared earlier that we have in our primary schools, particularly, the highest rates of COVID that we've ever seen in this borough. It's about 3 times as high in primary age children as it is in the general population in Bracknell. And as Gabby also mentioned, that's one of the highest areas in the country at the moment. So whilst there is no blanket recommendation to cease those activities, we're very mindful that each individual head teacher is required to have a live risk assessment document to determine whether or not those activities should or should not go ahead. That's done in consultation both with support from the UK Health Security Agency, formerly PHE, in an outbreak situation, as well as myself and other colleagues within the local authority providing that advice and support to head teachers in making those decisions. So it may very well be that some events or trips or activities or performances need to be cancelled, but that's not the blanket recommendation.
That's very helpful. Thank you for clarifying that. But I think as in all events, we've been very clear that it's down to a live risk assessment based on the situation individual school. But the guidance, we've been clear and consistent. It's the school's responsibility to undertake that risk assessment, and that our guidance has been clear and consistent on that. Thank you very much for that, Kelly. That's very helpful. Thank you. No other questions, Chair.
Any more questions? No. Okay. Elena, we've sort of touched on some of your area. Do we do anything else you want to add to your?
I've got a couple of updates just on what we've been doing, if that would be helpful to share with the board. Yeah.
Thanks.
Bear with me a second while I upload my presentation. Can everyone see that? Perfect. So as I mentioned earlier, our first priority this week has been to promote the new rules and the changes to encourage that positive behaviour change. As I mentioned earlier on in the last agenda item, unfortunately, we don't get any prior warning that these things are going to happen. So we do find out as soon as an announcement is made at a press conference. So as soon as those announcements were made on Saturday evening, we made sure we were quick to get that information out to our residents. With the easiest way of doing that on Saturday evening was via social media. We had a really good reach on social media, and our residents were engaging, but unfortunately some of the rules were a little bit ambiguous because we didn't have that clarity of message on Saturday. However, as we've got more clarity, we have updated all of our digital suite. So that includes social, websites, intranet, e-newsletters, which have already gone out, and we've reached around 20,000 people in the past couple of days. As I mentioned, we are working on a series of visual communications because we know that the messages are quite complex and they are quite difficult to understand. And our residents just want something really, really quick they can understand and make those quick and easy behaviour changes. So we're just working on those now, and they will be used for a series of out-of-home advertising opportunities. So things like bus back advertising, things like billboards, banners. We've got an ad van booked in to go around some of our smaller shopping areas, certainly over the next couple of weeks. And we're working with our partners as well, so people like at the Lexicon, just to get those messages out and make them really visual so people understand what they need to do and when they need to do it. Our engagement team are also helping us to push that message through the more harder to reach groups. And we're also sending messages out via our community information champions, who have links in to lots of different people to help us spread that message even further in a really understandable way. We had a slight hold the front page moment earlier this week where we had to stop Town and Country from going to press. That's due out next week to all households. So we've managed to pull that back and get updated messages into that. So that will go out to all households next week with the updated messages as far as they've been updated over the past couple of days. We've also pulled back the Bracknell News advert that's going out this week and managed to get that tweaked. So hopefully they're just the immediate changes that we've been able to do to get these messages out. We will obviously continue to monitor what is being mentioned by the government and any sort of additional communications that our partners need us to share over the next couple of days, weeks, as we run up to the Christmas period, where there'll be additional mixing as well. In terms of the new rules, obviously it's really important for us to get those messages out there as quickly as possible and as accurately as possible, but it's also still really important for us to communicate that positive behaviours around hand washing, ventilation, that kind of thing is still really important, as is vaccination, because there are still other strains of COVID out there which are affecting people. So that neatly brings me on to our vaccination communications programme. We're still continuing to use case studies. We have had support from Councillor Dale Birch and Councillor Ash Merry over the past couple of weeks, just saying why it's really important to get vaccinated. And that's not just for COVID, but that's for flu as well. And a really successful case study we used was earlier in November when a young girl from our area, she's 12 years old, Kira, she has unfortunately been very, very poorly with COVID, and her family very kindly allowed us to share her story. That reached around 150,000 people across social, and it was picked up in certain media outlets. So that really helped to get that information across in a very visible and a very understandable way to encourage that behaviour change. We are still looking for case studies. They're not particularly easy to come forward. So we will continue to look for those as time goes on, just to encourage people to take those vaccinations up. Our engagement team has been really busy working with different Facebook groups across the patch. They have made contact with a couple of Polish Facebook groups. So we're just adapting some of our messages now so that we can get more information out to different sections of our community in a way that they understand and the way that they want the information. Thursday, the 2nd of December, so this Thursday is it's something called National Boost Day. So across all public sector, local authorities, the NHS, central government, there's going to be a real push to encourage people to get their booster vaccinations. So we will share information from our partners at the CCG on that. And we're also working on a myth-busting section on our own website, which we can then cross-promote with additional information across different channels. And we're also doing additional posters in Polish, English and Nepali for sections of our community who go to different locations. They don't necessarily visit our Facebook group pages. They don't necessarily follow us on our website, or they might not read Town and Country. So we're getting some additional information on why it's important to boost your immunity this winter. And we're getting that translated into languages that we know that they've told us that they would like it translated into, and into areas like different shops and locations where we know they frequent, and they've actually told us that it's really important that we get those messages there. And finally, on behaviours, as I mentioned, it's still really important to keep on encouraging people to keep up with the good positive behaviours, so around hands, face, space testing and ventilating. We have a new radio advert starting this week, which specifically talks about ventilation and encouraging people, if they are meeting up, just to open the window for a little bit, and it will just help to disperse any particles that are in the air and reduce the risk of transmission. That should go out to around 300,000 people across the month, and that's all geo-targeted to the Bracknell Forest area. The Winter Wellbeing booklet was distributed a couple of weeks ago to all households and is being translated into Nepali for our community, specifically down in the south of the borough, where we know that that might be helpful for them to understand the messages in a translated language. A local Gurkha radio station has also been really helpful in getting some of those messages out, specifically on health behaviours. And as I've mentioned before, we are working on additional outdoor marketing opportunities, certainly across the borough, but also within the town centre. And we've got some new NHS messaging around ventilation and testing that we're sharing on our own Facebook groups, our own social media, our own digital channels, but also our engagement team, again, have been really busy working with different sectors of the community and trying to get that information out to a wider reach. They're the highlights. I haven't gone into specifics because I think it would take quite a long time for you to take any questions.
Thanks, Elena, and thanks for all the work that was done, especially over the weekend. I think I had my first update from Elena within, what, 20 minutes of the end of the press conference. So thanks for all the work that was done. And Gabby, apologies when I mistakenly almost referred to you for a moment as not working for us. I humbly apologize. It wasn't intended, but the spirit was there. Questions to anybody, from anybody? No? Great. I think, Elena, once you've got that final message, once the final message pack is ready and we've got all the graphics, it would be, I think it would be a really good idea once to do an all-member or all-staff briefing and ask people to share from share from our own website or our own Facebook site, as opposed to share their own records elsewhere, so we can try and contain and spread that message out. But I'd like to thank everybody for the work that has been done since the announcements over the weekend in both comms and in just the overall position of change. I think we're probably going to see more over the next couple of weeks as we kind of get to grips with Omicron. I still think that sounds like a villain from a movie. Are there any other questions or updates from around the table on these sections before we move on to public participation? No, and I noticed that Councillor Hayden has joined the meeting as well, just to acknowledge that. Okay, public participation on the next section. Do we have any questions or comments from the public?
Chair, I'm not aware of any questions that have been submitted to the committee Dropbox in advance of the meeting.
Okay, just conscious of the time, moving us through to the action log, which looks like, by exception, it's the usual item of fake news. I think there's perhaps more importance of asking members to get that done. I've seen some horrific fake news stories and deliberate misunderstanding or unintentional misunderstanding. And I think as we go through this change curve of messaging, I think Elena's right that our message has always been simple. As we go through the next couple of weeks, we need to keep on top of anyone that's not understanding perhaps what the situation looks like. Anything else? No, in which case, thank you for your attendance on the meeting this afternoon, and